So burnout is complex, and there is a classical definition to, if you will, diagnose burnout, and it consists of a sense of exhaustion by an individual, and even in the face of, say, adequate sleep, there's a sense of inefficiency that the individual is unable to complete usual tasks, and they feel like they can't cope. And then there is a sense of depersonalization, of a disconnect of an individual and their daily environment, or from a physician from their patients. And sometimes that depersonalization manifests itself as cynicism. And so I don't know that there is one most common manifestation. It can manifest in very different ways and in different individuals, and even in the same individual. Personally, one of the early telltale signs that I've seen, particularly in highly functional individuals, is they become more cynical. They become more pessimistic. Their conversation may include more biting sarcasm, and to the point sometimes that they can become disruptive. Other individuals may become just withdrawn, even quiet, not engaging in at the level that they typically do. So I think that's the challenge, is it has very many different faces, and sometimes those can be subtle, and particularly early on, which is when we want to try to identify it. So I think that makes it really a very difficult diagnosis. Same thing. It's really complicated. I don't know that you can point to one thing. Um, at an organizational level, it's not just about making a physician work too hard. In fact, most physicians have always worked hard. That's part of the profession, frankly. But it's a sense of a physician not having control in their life. And a common example that's cited in the literature is the introduction of the electronic medical record, the EMR, which was in some ways thrust upon physicians and without a sense of control, because it was mandated, and many physicians were unable to take part in the development of their local EMR. So again, it was increasing their burden without their input. And some even discuss this concept of moral dilemma. And this was first described in soldiers going to war, where they were asked to fight, even to kill on the front lines, sometimes for values they didn't support. And so they had a moral dilemma of being there. Many hearken burnout in physicians to that we have taken a Hippocratic oath to take care of our patients, yet in some cases we've been put into systems that do not allow for that. Again, back to the EMR, we now find ourselves spending more time with data input instead of face-to-face interaction with our patients. Other things you can look at on the institutional level, the work environment. Are physicians being asked to do a reasonable amount of work? This is particularly concerning with after-hours call work, or what we see in radiology with shift work with our overnight physicians. Is there adequate time to recover from these shift changes? And again, it's about having physician control. Does the leadership structure allow for physicians to weigh in on their life's work, and do they feel fulfilled by what they're doing? Well, there's several ways to promote a positive culture in a department, on a team, on a committee, whatever the group dynamic is, but it begins at the top with the leader. And there's ample body of work around the impact of leadership and leadership style in burnout or the mitigation of burnout. And most of us work in a highly matrixed organization, and the leadership truly needs to support their physician team. And it really touches so many things, even as we have conversations about diversity and inclusion. This directly links to burnout. Individuals who suffer harassment or microaggressions on a repeated basis, they are more prone to burnout. Leaders that develop inclusive cultures, not only really having zero tolerance for harassment, but also other things, supporting part-time individuals, which is important for our diversity initiative, supporting our breastfeeding mothers, supporting diversity in every definition, not just gender, race, diversity of generation and ability. Leaders who can create these cultures where physicians belong, have a true sense of belonging, and where they feel empowered and have autonomy to be physicians, to be radiologists. Those are all things that contribute to mitigate burnout.